there, my name is Sarah. I'm going to be your nurse today. Can we start off by just telling me your name and date of birth?
Yeah, my name's Christian. I was born March 25th, 1995.
Okay, well, nice to meet you, Christian. And like I said, my name is Sarah. I'm going to be your nurse today. I'm mainly going to be teaching you about how to check your pulse because you were started on a beta blocker, and it's really important that at home that you can check your own pulse while you're taking that medication, okay? So first off, I'm just going to start by, what are ways that you learn best?
Just by having something shown to me, really, kind of doing hands-on stuff is the best way, yeah.
Just being taught, or like a demonstration and then with you listening, and then reflecting on what you've learned. Am I understanding you correctly? Okay, perfect. So then I think this will work perfectly because I'm going to show you how to check your pulse, and then that's the main thing I want you to learn from this. And then I also want you to learn like what you would do if your pulse was too low or too high or something like that, okay? So also, just to start out, I do have some educational materials that I did go ahead and print off for you that you'll get to take home with you today, just in case you forget to ask any questions today, or if you need clarification on anything, okay? So now I'm just going to show you how to take your pulse, all right? So what you do first off is, I'm right-handed, so I use my right hand and knife to check my pulse, and then I just feel with my fingers kind of along the line of your thumb here. You feel until there's like a little pocket or like a divot or something there, and you should feel that's your artery, and you can feel it pulsing, and so we're checking your pulse. Do you kind of feel that little like rush of okay, so you can feel that there?
Yeah.
Okay, let me feel where you're... Yeah, perfect. Okay, so then what you're going to do basically is you're just going to hold your hand there for 1 minute and just check how many pulses or how many beats you feel, and that'll tell you how many times your heart is beating in 1 minute. Okay?
Gotcha.
So let's just do that together.
All right.
So you feel yours, and we'll just, for 1 minute. Okay, how many beats per minute did you get, Christian?
About 84.
84? Okay, perfect. So some main things to remember while you're checking your heart rate is that you want to do it for a full minute, that way you're getting an accurate beats per minute. You never want to check it like with your thumb, because sometimes you will feel like the pulsation that's actually in your thumb, and it can like kind of hinder your count. So you never want to do that, and then just always count for the full minute. So some main things with this beta blocker that you're going to be on, it is used to treat, like hypertension, which is high blood pressure, or a high heart rate, or sometimes what's called angina or chest pain, or like heart failure, things like that. So with this medication, it can actually, it works to lower your heart rate, and so sometimes it can lower your heart rate too much, which is why we always want to check your heart rate before you take the medication to make sure that your heart rate is not too low, which is known as bradycardia. So too low would be below 60 beats per minute.
60.
Okay? 60 beats per minute. Okay, so you've shown me how to check your pulse. Do you have any questions about that? Do you feel confident that you could do that at home?
Yeah.
Okay. All right, so then tell me some things you want to remember while checking your blood pressure. Your pulse, excuse me, I'm sorry.
Don't use my thumb.
Correct.
Make sure, clearly that I can feel it. If it's under 60, I probably don't want to take my medicine.
Right, and you would want to call your doctor and just let them know, and then see what they want, have you go from there.
Sure.
Okay. All right. So then I gave you the reading material. So if you do have any further questions, or if you get a little confused, you have that. And then you also have our phone number here, so you can call if you have any questions. Okay.
All right.
All right. Thank you, Christian.
Thanks.